Good afternoon. We would like to welcome everyone to the Office of the Prime Minister in Grand Bahama. To our Prime Minister, the Most Honorable Hubert Minnis, our Deputy Prime Minister, Peter Turnquest, and also Minister Iram Lewis, other parliamentarians, ladies and gentlemen, members of the press, good afternoon. We are particularly pleased to be joined here this afternoon in Grand Bahama by our Prime Minister. Please help me welcome our Prime Minister, Dr. the Honorable Hubert Minnis.
Thank you very much, Kwesi. My cabinet colleagues and parliamentary colleagues, Dr. Freeman Lockett, Medical Chief of Staff, and Ms. Sharon Williams, Hospital Administrator at Duran Memorial Hospital, residents of Grand Bahama, ladies and gentlemen of the press. This afternoon, I want to provide Grand Bahama, the country and the media with a number of updates on the ongoing and phased reopening of the country and the economy, including a number of changes to the emergency order. I came here to personally thank the people of Grand Bahama for your cooperation during the various lockdown periods. Your actions and community spirit made an extraordinary difference in arresting the community spread of COVID-19. I thank you for your sacrifices. I thank you for your determination. And thank you for your resilience during this most difficult time. I know it has been very hard for so many of you, but your sacrifices and your discipline have made a tremendous difference. It is important for you to keep doing what you are doing. COVID-19 will be a part of our lives for some time. And we have to learn to live with it. We must strike the responsible balance between keeping our economy open and practicing the public health measures so the spread of the virus is kept as low as possible. We all know the rules. Wash and sanitize your hands regularly. Wear your mask properly over your face, nose, and mouth. Stay physically distant from others, and do not attend mass gathering. Continue to make the public health guidelines and guidance a regular part of your life. And please urge your family and friends to do the same. The more we keep the virus suppressed, the more normalcy there will be to our lives. Let me also thank all of the public and private officials, including medical and security personnel, feeding networks, businesses, officials at OPM here in Grand Bahama, and others who worked in a spirit of unity. It is with enormous gratitude and admiration that I thank all of you. And I thought it was even more important for me to come here and thank you personally. The people of Grand Bahama demonstrated a "we should" solidarity and attitude. Ladies and gentlemen, today I am pleased to announce a number of amendments to the emergency orders which apply to all islands in the second schedule except for New Providence, where we are still working to lower the community spread of COVID-19. These changes apply to the islands of Grand Bahama, Abaco, Auckland, Andros, the Berry Islands, Bimini, Cat Island, Crooked Island, Eleuthera, Exuma, Mayaguana, and Inagua. Businesses, agencies, establishments, and institutions will be able to operate subject to the safety protocol with few exceptions that are high-risk activities. The high-risk prohibited businesses continue to be casinos, bars, discos, cinemas, gyms, regattas, festivals, and similar activities. The new amendments mean that retailers will be able to offer in-store service. Restaurants will be able to offer indoor dining services, provided they follow the physical distancing, mask wearing, and sanitization protocols in the order. Fish fry establishments will continue with takeaway and curbside services only. The changes announced today mean that businesses that had not been permitted to open or that were opened with restrictions may now operate following the public health measures. They may determine their operating hours operating from 5 a.m. until 10 p.m., and this is except for New Providence. Let me again note that the risk of spreading COVID-19 is higher with regard to indoor activities and lower in regard to outdoor activities. And this is why we have continued to make certain distinctions in terms of outdoor and indoor activities. In keeping with these distinctions, I note that residents on all islands in the second schedule, except for New Providence, may have small social gatherings of up to a maximum of 10 people. And we encourage you to do so in a safe manner. Residents on all islands in the second schedule will now be able to exercise outdoors in their neighborhoods from 5 a.m. to 10 p.m., and this includes New Providence. Residents on all islands, including New Providence, will be able to participate in outdoor group exercise between the hours of 5 a.m. to noon. Residents on all islands, including New Providence, will also be able to visit beaches and parks for slightly extended hours daily from 5 a.m. to 12 noon. Let me note a number of amendments which apply to the entire country. Charters are now allowed, including inter-island charters, provided that individuals comply with the inter-island travel orders. Inter-island commercial air travel may resume as normal as of this Wednesday, the 9th of September. COVID-19 test results are no longer required for inter-island travel, except for those traveling from New Providence. However, individuals traveling from islands included in the second schedule, including Grand Bahama, will continue to be required to quarantine for 14 days upon arrival at their destination. Exemptions from quarantine may be requested and given in cases of emergency, medical, or other extenuating circumstances. this travel protocol is subject to change. What that means, individuals traveling from Grand Bahama to any part of the Bahamas would no longer require a COVID test. To be clear, if individuals travel to New Providence and seek to return to any other island, they will be required to obtain a COVID-19 RT-PCR negative test and the 14-day quarantine once you've left Nassau. Private medical facilities and dentists are able to provide services outside of the curfew hours and medical services during the curfew hours in an emergency. Worship services are allowed in sanctuary in New Providence following the health measures and guidelines for such services. Ladies and gentlemen, we remain much focused on Grand Bahama. We know the economic struggles you have endured for many years. Some of the largest economic concessions were provided for the residents of Grand Bahama and Abaco following Hurricane Dorian. They were both declared economic recovery zones. We continue to work hard to rejuvenate Grand Bahama. The two major investment projects approved for Grand Bahama include the ITM Group Royal Caribbean Cruises and Lucaya Hotel Project and the Carnival Project. I am pleased to report that we remain positively engaged with our development partners on these projects. They remain committed to the implementation of these projects, which I will have more to say about in weeks ahead. The government is continuing discussions with Hutchinson Ports, along with the Grand Bahama Port Authority, to finalize an agreement on the best way forward in rebuilding a world-class Grand Bahama airport. Indeed, we are preparing the entire country for reopening and rejuvenation post-COVID-19. Just last week, we signed the heads of agreement of the $400 million Jacks Bay development for South Eleuthera, which is a Bahamian-owned investment. Ladies and gentlemen, the government remains committed to providing emergency food assistance during the pandemic. The Grand Bahama Food Task Force, through the Feed Grand Bahama program, continues to assist those in need in our community. And I am advised that this program has distributed over 12,000 vouchers to thousands in need, totaling approximately $1 million. The Department of Social Services in Grand Bahama, the National Insurance Board in Grand Bahama, have made significant payouts to residents affected by Hurricane Dorian and COVID-19. The Disaster Reconstruction Authority's Small Home Repair Program has approved approximately 2,000 Grand Bahamians for repairs. We continue to invest in critical infrastructure to improve the lives here on Grand Bahama. $4.5 million in contracts were awarded in June 2020 for major reconstruction to 15 schools here in Grand Bahama. $21 million has been allocated for the phased redevelopment of the Rand Memorial Hospital, and work is steadily progressing with demolition, new construction, additions, and renovations. The Fishing Hole Road Bridge has been completed and officially opened. While we are making progress on Grand Bahama, there is still much more to do. COVID-19 may have delayed our ambitious and comprehensive plans for Grand Bahama. But once we have beaten back this virus, our plans will continue into full force. Ladies and gentlemen, while I am pleased that most Bahamians are listening to the public health advice, a number of us are still engaging in high-risk behavior, such as getting together at parties. I wish to remind the public on every island that wearing a mask in public places is mandatory. The police will be enforcing these measures, including issuing tickets for those in violation, and the fine for not wearing a mask is $250. As it relates to construction sites, the police will be monitoring sites to ensure mask-wearing protocols are being followed by all construction workers. Construction operations will now be fined for non-compliance with the orders related to mask wearing and other physical distancing protocols established by the Bahamas Construction Association as approved by the Ministry of Health. On a second infraction, the fine will be doubled. On the third infraction, the construction project may be closed. This is extremely important because we're experiencing today serious concerns with the construction industry. The construction industry presents challenges to the health sector with respect to COVID-19. And it is essential that they wear their mask so as to assist us in eradicating or diminishing the level of COVID infection that we see today. To put it in a nutshell, what we see is the construction industry now becoming the so-called breeding ground for COVID-19. However, if you wear your mask, according to protocol, then we would be able to eradicate and deal with this problem. The workers' cooperation on the construction sites would help us to open our economy more smoothly, would help us to decrease unemployment, would help us to invite our tourists and guests into our shores very safely. Ladies and gentlemen, I wish to once again offer condolences to the families of all those who have lost loved ones because of this deadly virus. Let us continue to pray for all of those in hospital or at home or are ill and those recovering from this deadly virus. At every opportunity, I want to thank the healthcare and medical officials who have been on the front line of this battle from the beginning of this pandemic. They too have demonstrated the spirit of we should. They are the face and the spirit of courage and resilience. I want to again discourage large social gatherings and parties. At my last address, I spoke about my granddaughter, whom I had asked to give me a kiss. And she came to me and said, "No papi, no kiss, COVID, elbow." Last week, Wednesday, was her birthday. And I asked her, 3-year-old, now becoming 4, last week Wednesday, and I asked her, would she love to have a party? And she said, no, puppy. Party means gathering. Gathering means COVID. COVID means sickness. That was the voice of a 4-year-old who denied having a party. But mind you, she got somebody to escort her to John Bull and picked out something by far more expensive. And she left a message at John Bull that her papi was coming the following day to pay the bill. We are able to relax, or we must implement more restrictive measures depending on what we do together to limit the spread of COVID-19, which you see from the news is still very much out of control in many countries around the world. There are a number of very ill people in our hospitals. This virus has lasting effects, some of which we still do not know about, and which may do damage for a long time or a lifetime. This is why I keep asking you to be safe and to take care of yourselves. In this phase of our reopening, we each have the ability to lessen or to increase our risk of infection and the risk of infection to others. Let me close with this powerful example I heard from the parent of a daughter who was due to return overseas to complete her university training. And this young lady agreed not to return to school this semester, not because she feared getting seriously ill from the virus. She agreed not to return at this time because she did not want to help spread the virus to others, including older people. This is the quality of sacrifice, the strength of character, and the generosity of spirit we all need to combat this deadly virus. I again thank all Bahamians and residents, including here on Grand Bahama, who have been their brothers and sisters' keeper. We will reemerge from this battle to restore our country stronger and together. Before I close, I want to extend condolence to the family of Dr. Philip Slammy Thompson, who had just recently passed away. And I know that members of the Junkanoo community are agitated and eager to go and exhibit their skills by rushing. That could be very dangerous for our country. Philip Thompson, as a disciplined, responsible individual and a physician, if he were here, would ask the Junkanoo community to do not place lives of themselves and the Bahamian community in danger. He, I'm certain, would ask the Junkanoo community to wait until the time is right or until the pandemic is over. I thank you very much. May God continue to bless each and every one of us. God bless the Commonwealth of the Bahamas. And I'm now open to answer all of your questions that are available here from members of the press.
Good afternoon, Prime Minister. It's Talia Hall from ZNS here in Freeport. Here in Grand Bahama, you thank Grand Bahamians for coming together to push through this difficult period. Can you confirm that we are seeing a flattening of the curve, our numbers dropping here in Grand Bahama?
Yes, I've been assured that your numbers are dropping, that Grand Bahama has done very well, displayed discipline, and the medical community has acted responsibly and managed the situation here very well. I'm also informed, and I can call Dr. Freeman Lockhart, who can tell you about the medical situation, as I understand that the numbers of individuals in hospitals are decreasing. But I would call Dr. Lockhart to speak to that.
Thank you, Prime Minister, and thank you for that question. What we are seeing here in Grand Bahama, if we put things in perspective, since the late July, which would have been the start of the second surge here in Grand Bahama, to the present, we've seen a 75% drop, approximately 75% drop in COVID-related cases presenting to the emergency room. That is significant, quite significant, since mainly the number of hospital beds are not at risk. We were at a point in late July, early August, where we were concerned about the capacity here in Grand Bahama. And that's where we saw the maximum numbers of COVID-related cases, both positive and suspected cases. Our capacity was able to sustain the numbers of patients, and we are thankful that what we are seeing now is a decline in patients, and as a result, the concern as it relates to the capacity here in Grand Bahama has settled. Thank you.
Yes, Ms. Hall, that's it?
Hi, good afternoon. Denise from the Tribune. I wanted to know how many patients are now in hospital?
Only Dr. Lockhart would be able to answer that.
Thank you again for the question. And I presume you are talking about COVID,
Yes, COVID
right?
patients.
The total number of COVID patients we have in hospital presently, 10. We have 7 of them. 7 of them are positive patients, and the remainder are COVID suspects whom we are waiting the results of.
Can you tell us what sort of treatment are they getting in terms of to help fight this disease?
Okay, as you are well aware, most of the care COVID patients, COVID positive, COVID suspects are receiving now are supportive care. In the absence of any definitive treatment, that's what we have available. A lot of them who require treatment as such, they usually get oxygen of some kind, whether or not it's just something to supplement or high level ventilation. A few of them have even required intubation, but very few here in Grand Bahama. And also hydration. So that's the extent of the treatment for COVID. But as you can imagine, there's always the concern of superimposed infections, and that usually results in additional antibiotic therapy where there is a concern of possible bacterial infections.
There's a local doctor who's talking about that the treatment of antibiotics is not effective, and he's saying that there's local drugs, like over-the-counter drugs, that patients can be used to be treated with, and he's also saying that the lack of treatment is can cause, or studies are saying that it's causing some patients to have pulmonary, like reduced pulmonary function and maybe stroke.
Okay, I would agree with him in that antibiotics are not effective. Antibiotics are not effective for any viral infections. Antibiotics treats bacteria. But you have to keep in mind that in the case of a COVID-related patient or COVID-related case, there is always the concern of possible bacterial infection. And where clinicians are concerned about possible bacterial infections, then there is always, they would always initiate bacterial treatment, which are antibiotics. Now, as you would have mentioned about, the second part of your question was about complications. So some of the complications I'm sure you would have read about was vasculitis or vascular complications as it relates to COVID infections. And that can cause delayed complications of as it relates to vasculitis. Also, the lung infection that you would have mentioned that results from the scarring that COVID causes, that's what can cause the later difficulty breathing and problems with ventilation as a result of underlying COVID infection. So those are some of the complications that we are seeing, we are reading about, and we anticipate down the road for patients who have had COVID infection.
Okay, my second question is for the Prime Minister. Atalia Hall here again. So there have been strict measures put in place that's been tough on businesses here in Grand Bahama. Any idea as to how the industrial sector is coping? There have been some layoffs as well. When do you see the industrial sector rebounding here in Grand Bahama?
The industrial sector, of course, throughout the world, businesses had suffered and had cut back. The industrial sector has not been excluded, but they have reassured us that as soon as possible, they would expand their productivity and commence additional hiring. But of course, they're going through the same changes as the remainder of the world.
Good afternoon, Prime Minister. Good afternoon, everyone. Karen Ferguson-Bain from Global 99.5 FM. Our elderly homes have shown extreme care. The COVID cases, at a minimum. None, to be exact. What are the protocols that they've used that we can teach our construction workers so that they can follow the same protocols? And are there any plans to implement any educational material for them to follow?
Well, we recognize that there were certain sectors. Thank you very much for the question. We recognize that there were certain sectors that are, which we would call high risk, areas like the elderly home, prison, and those type facilities. And what was immediately done, all those individuals who are employed in those facilities were immediately tested and went through protocols to ensure that they were not positive, because you might imagine they could have brought the infection from outside, inside, and thus causing problems. So there were strict regulations to ensure that the staff adhered to minimize or mitigate any possibility of infection being introduced. With the instruction industry, I think what is extremely necessary is for them to utilize and wear masks. And I think once they do that and adhere to other policies, other mitigating protocols, I think that would help us tremendously.
Thank you, sir. And for my second question, we know that Grand Bahama has the second highest number of COVID cases. However, the Ministry of Education announced that we will offer face-to-face teaching. Schools will open for face-to-face education. Is there a concern moving forward with schools opening and offering the face-to-face method?
Thank you very much. I think the Minister of Health, Minister of Education had addressed that quite extensively. And what he also said is that protocols may sometimes change, and he would continue, and ministry would continue to monitor the situation, and just as protocols and approaches to education are changing rapidly in the U.S. and other parts of the world, the same changes can occur here. And he had pointed out that we would monitor and make the necessary adjustments, because the most important thing is ensuring that our children are not infected.
Good afternoon, all. Jamie Smith, the Freeport News. Prime Minister, the Minister of Tourism just recently announced that his ministry anticipates an October 15th reopening of all major hotels. throughout the country. And he's hopeful for full tourism opening in early November. How confident are you that Grand Bahama will rebound with respect to the country's #1 industry?
Grand Bahama tourism has not done very well here in Grand Bahama. As you know, you've had challenges with the hotels, etc. And that hotel is, we're in negotiation now, discussion to get that sold and expanded, whatever changes are necessary. And we're looking at other construction modalities here in Grand Bahama Port, Carnival Cruise Port, which is still on course to be to commence and completed. With respect to tourism in general, Ministry of Health and Ministry of Tourism are in discussion along with the hotel to ensure that we have necessary protocols in place once the hotels are open and airlines are traveling, necessary protocols in place to keep the infection of COVID at a minimum. And I think they're working aggressively to do that. They would have spoken about some all-inclusive type phenomena, meaning that individuals, it's a particular word they use, I can't recall the word, meaning that individuals who enter the hotel can utilize all the services that are defined in the Hotel Encouragement Act for that particular hotel. In other words, they can utilize all the amenities, their restaurants, gyms, etc. And I think that in itself is an attraction, knowing that individuals traveling their shores have access to all the hotel amenities.
Good afternoon, Prime Minister. You mentioned the small homes repair program in Grand Bahama. Apparently, we understand that some vendors are not being paid by the government, and they're no longer releasing supplies to homeowners who want to repair their homes. Can you tell us or explain to us if that is true, if vendors are not being paid?
Well, we have the minister responsible for small home repairs and disaster reconstruction. I'm sure he'd be more than happy to entertain your question, answer your question.
Good afternoon, and thank you very much. The matter that you raised was an issue that is being sorted out. So we have undertaken to resolve all issues that we have. All of the vendors will be accommodated in short order, so the program will continue. But it was a challenge that was brought to our attention, and rest assured that it is being sorted out. So by the end of this week, we'll be in good shape.
Thank you very much, ladies and gentlemen. Thank you very much, ladies and gentlemen. We want to, first of all, thank the Prime Minister, who came from New Providence and provided us with some good news in Grand Bahama. And he also provided us with an update with respect to COVID. So we want to thank him for attending. We also want to thank our local parliamentarians, the Deputy Prime Minister, as well as Minister Lewis and Senator Jasmine Darius for attending. We also want to thank our medical professionals, Dr. Lockhart, as well as Ms. Sharon Williams, the hospital administrator. Unfortunately, we are going to have to leave as we do have a tour of the hospital. As many of you know, the hospital has been under full construction. We are nearing completion, and so the Prime Minister is also going to view those facilities. And we also will take a look at the construction going on at the airport site as well. So thank you very much for attending, and good evening.